We are, hello Facebook, we are about to do a segment here on the John Williams Show. You can listen to this on 830 WCCO Radio. The folks from Hydrate, Minnesota, have a series of hydrates you can get, help you everything from jet lag to hangovers to sports performance to beauty and wellness. Probably timely, what with New Year's Eve being right around the corner. And so Susan and Jordana thought it would be a good idea if they did it to me.
It is a good idea.
We're loving it.
Yeah. I'm just a little apprehensive because I'm a little queasy about...
we think you'll like it too.
Needles.
Can we look at the needle?
No, I'm not going to watch that part.
You don't have to, but I think we should let our audiences see
So
it.
it's actually
let them introduce themselves. Yeah.
So
No problem.
hi, this is Bryn.
Hi, I'm Bryn. I run the whole company. I'm also a nurse, and I brought my paramedic Justin here.
6:30 on
to be the
CCO
one to do
Radio.
it all.
So we are
Hello, I'm
live on
Justin.
the radio now.
So,
and Susan
we
is right now on Facebook streaming the folks from Hydrate MN, and they're going to be doing this to me. I've got to find a way different to describe what's about to happen. They're going to be doing this to me.
Well, they're going to stick a
Administering it.
Administering an IV.
I'm going to get a, you
that okay
want
if
to
I cover
administer
this
the
up?
IVR. He's going to do that over here. By the way, just one other quick note. Did you see the story, Jordana, that upon Carrie Fisher's passing, Cinnabon, the company, wanted to do a tribute to her? And so the folks from Cinnabon posted a sort of artistic rendering of Carrie Fisher as Princess Leia, and then they had her ears. You know how she'd have her hair kind of curled on the
I
sides?
do, yes.
They put Cinnabons there.
Yeah, Cinnabons.
And
Exactly
then
right.
they said, you know, like R.I.P., best buns in the universe, you know, something like that. And one of the first tweets about that was from somebody that said, okay, everybody, take a screenshot of this before they take it down, because they are going down. And then lo and behold, the Twitterverse blew up on it, and they said, anytime you use somebody's passing as a marketing tool, your best tribute intentions will always go awry. I don't know what the answer to that is. I mean, companies can have feelings. They can try and do good. They could wish somebody well. I thought it was kind of funny. And, you know, the sides of her head did look like Cinnabons or cinnamon rolls. In fact, they did a segment on Friends one time where Phoebe made fun of that. I mean, it was just a little joke. So when I saw that, I kind of got it. And it's, I don't know, something strike you as, it works, something strike you as real tacky and poor. That one didn't bother me. I think it came from a good place, and you sort of got it, and that was the end of it.
And she probably would have laughed.
That's what other people said that knew her.
Yeah.
They said, oh, she would appreciate that.
Absolutely.
She was pretty snarky and wry and sarcastic.
And she had fantastic buns. Have you seen her in that outfit with Jabba the Hutt? Holy crap.
Well, that's going back to the earlier days.
Yeah. Well, again, she was a 60-year-old woman. I don't know that many 60-year-old women with fantastic buns. Sorry if you are one. But, you know.
I would
Look better
say,
at 23.
as a rule, unless you know there could be no way this would be interpreted as, you know, poorly executed, you shouldn't, if you're a company, do that. If you or I did that,
No,
maybe
you should not.
But if you're Cinnabon, probably that's
Yes.
you mean well, but just don't do that. Don't do that. Their absence of a tribute to her would not have been conspicuous. People wouldn't be today going, wow, Cinnabon didn't do anything about it. You know, so you don't have to go there. All right, it's 6:33. We'll check the traffic here, and then we'll tell you about Hydrate MN. What a fascinating concept here on WCCO.
Okay, so go ahead and explain everything.
Okay,
Yeah.
sure. So this is the basic setup that that you'll see if you order, so you do it in your home or place of work or whatever. And it'll be myself or Bryn or one of our other paramedics that will come, and it'll be a medical professional. And this is pretty much all the space I need. We just have a small travel pole with the IV bag and everything.
So you would take this to somebody's office or home or
Yeah,
whatever?
precisely. Yep. And this, like, literally, this is the whole setup. I have this blue bag here goes with, and then just everything you see here. So the whole thing gets set up in about 5 minutes. The needle that we use, it's actually a pediatric size needle. It's a 22 gauge.
Yeah.
So yeah, it's for the
nobody asked
it's
for
it's for the babies. So I'll just kind of show you. So the standard size needle is actually an 18 gauge. This is a 22 gauge. So it's quite a bit smaller than most needles that you would get if you were like at the hospital or an ambulance or anything like that. So and that's basically just to keep the pain level down, so you don't have to get scared of the needles.
Pain level
Should we go
then.
and do this live on the air, the actual?
Oh, yeah.
Are you gonna
IV?
faint?
How do I look? Do I look like
Take a look
I'm?
at, for this, if I can get you to just have a seat there, you can, once I get you rolling, you can, can
Have
this
you
seat
drank
actually go
anything?
down?
What if you can't find your vein?
Oh, here you go.
6:34, 29 degrees. JP's got your roads. Go ahead, Jerry. Okay. So what do you need to know here?
Can this seat go down?
Yeah, I can.
Just for the, and like I said, once I get you rolling, you can
Yeah,
make
the
yourself
first
comfortable.
couple minutes of this is about our comfort level, and then after that, it's all about you.
If it doesn't, don't worry about it.
The one next to her probably is lower. Let's switch out.
Okay. My main thing is, it doesn't.
What you thinking, Jor?
I'm thinking, I hope he doesn't pass out because then I have to finish the rest of the show. Which I will happily do, but he wasn't feeling so good when he came in, so this will make him feel better, but I really hope he doesn't pass out from the needle. John, you don't faint from needles, right?
You frightened of
Jordana,
needles?
do you? Let's find
No,
out.
I-
Why don't you do this?
Now I feel a little worried about you.
That's pretty easy to find.
John, can I move your screen a little bit?
Do you want me to wait?
This way?
I suppose we should. Let me ask you this: will I notice the hydration effect right away?
Yeah,
You will. You'll feel it going in. It's going to be like a cool sensation going up your arm at first. It's basically just the temperature of the liquid that you feel. You might taste it a little bit.
Ooh.
You
Weird
almost get
enough.
like
Yeah.
you almost get like the aftertaste of a. It's kind of like a Flintstone vitamin.
Ooh, metal?
Not exactly metal. It's kind of just like a vitamin taste. Like, well, because the thing is, we're basically giving you an entire month's worth of like a good multivitamin is what you're getting here. And you have capillaries in your taste buds just like the rest of your body. So anywhere you have blood, you're gonna, this is going. So that's why you taste.
Well, then
it.
I think we should wait and do that on the air then, don't you think?
Oh, definitely.
Dan, is it?
So, and then just to kind of prep you, once I do have it going, I'll just have you keep your arm kind of generally straight. If you want to stand up and stuff like that, once it's rolling, that's fine.
That's okay.
Like I said, we just like to have you sit down just for the actual initial getting the IV, just because we have had people actually pass out.
Oh, dang. Now we have 23 viewers so far. So hit it up again because these
Say
people
hi
are...
to some of them. Carol Esterly was watching. Jason English, we see you. Hi there, Jason. Thanks for watching.
Peace out. Tell your friends this is going to be a service you may use someday.
Jet lag, hangover,
Yeah, that's
cold and flu, what other...
That's
Is it
what's
gonna, you're
cool
doing
about
the
what
health
we do
and
is-
beauty, so is it like a
No, we
Well, let's
actually
do the health and
switched it
beauty.
up.
Oh,
We were
we
gonna have him do health and beauty, but
There we
since
go.
he fell ill, we thought we should get him sick.
Okay, I don't know if you're near your smartphone or a browser, but you can watch this half hour of the show on Facebook. We are live streaming it on WCCO Radio. I'm John Williams. It's 29 degrees outside. Sports to the max at 7 o'clock this evening. Lots of Gopher football to talk about these days, plus holiday high school stuff. That's with Mike Max. Jordana Green comes your way at 9 o'clock this evening. And as always, George's going to have a swell show for you. In our studio is Bryn Ahrens. She is the CEO of Hydrate Minnesota. Hi, welcome to the show.
Hi, thanks for having us.
Again, we're live streaming on Facebook. You can watch this conversation right now. What's Hydrate MN?
We are a concierge medical company that does IV hydration. So we access a vein just like we're going to do and everybody gets to see on Facebook. And we're putting an entire liter of fluid into your body on the cellular level as opposed to drinking water. So we're getting you hydrated, the equivalent of you taking in 5 liters of water by drinking it physically.
Oh, really?
It's the that's the equivalent of one of our IV bags.
Is Hydrate MN a franchise operation, or are you guys...
Not yet. Maybe we will be.
This is your idea?
Well, we've got a partnership group, and we all kind of came together and said, they're doing this everywhere else in the nation. We can do this, and we can make it better. We can approach
Doing what?
doing IV hydration therapy.
So this is a thing out there,
It's a
IV
thing.
hydration
It's
therapy.
an actual thing.
I'm sorry, I've not heard of that before. IV hydration therapy.
Yeah, it's so celebrities are using it for the beauty aspect of it.
Really?
Athletes are using it all across the country.
See that all the time. The circumstances, the weather,
Yeah.
an intense game, you'll see them get hooked up with an
Yep,
IV.
absolutely. So your athletes, runners, and marathon runners are professional athletes. We do a lot of the Vikings players, all that stuff. You're going
Really?
to see it. Yeah, we do. So you'll see a lot of that, and then Vegas, huge for hangovers.
Really? So really, but I'd never even anticipated that. That for hangovers, you
Yeah.
go, oh man, that was a long night.
Yep.
And then someone comes in and does IV hydration therapy for you.
Yes.
Is it the same stuff you put in for all of these circumstances?
It's not. We actually make different cocktails, we call them, and concoctions based on what we're looking to treat. So it's all about the signs and symptoms that we see. So signs are things that we as medical professionals can see. Symptoms are things we hear from you. You say, oh, I had a rough night, I had too much alcohol. Then we know we're going to probably access, the hydration bag with, for the hangover. I just ran a marathon. Well, okay, we're going to go more to the athletic bag. We have different amino acid blends, different antioxidant blends, different vitamins, minerals, all this electrolytes. It's just what we're trying to tackle.
What if I just drank a bunch of Gatorade?
You absolutely could, but the absorption level, like I said, you probably get about 1/5 of what you're actually drinking would truly be absorbed into the cellular level and actually get to where it needs to go.
I presume this is more timely too, because you're delivering it right into the
Immediately. I mean, if you can get in 5 liters of water a day, cool, do it. I don't know many people who can.
Yeah.
It's difficult. I mean, it's difficult.
How is the beauty component? How does Hollywood use it?
So cool. So glutathione is actually an antioxidant. It's like the super antioxidant, king of all kings of antioxidants. It can actually rid your body of free radicals and just garbage. It's almost like a cleanse, I guess you'd say, on more of the cellular and within your blood. Can clean out the liver and kidneys, even in the stomach. You can get some of the gook out of the stomach. So along with doing that and ridding your body of the free radicals, you're actually getting the benefits of that fluid because it's not going through all the yuck first.
Well, if I put this is a liter that you're going to put in me here, of fluids into my veins, where I live, then where is all of the stuff going to go that was already there? Do I have room for 9 liters in me? Don't I already have 8 liters in me?
So you've got, what do you think, Justin, 5, 6 liters of blood?
I got your size. You have probably about 6 liters of blood or so.
6 liters of blood, all right, but now I'm going to have 7 liters of stuff.
All we're doing is essentially diluting your blood.
Well, that can't be good.
It actually is really good.
Really?
Yeah,
You're
it
sure
truly.
about that? What's your medical background?
I'm an assistant.
You're a clerk at Holiday.
I am. I actually, it's Quick Trip.
Is he gonna have to pee a lot?
So
I was wondering about that.
So some people do. Because you're ill, you might be surprised at
I have been ill.
at how long it takes you to really, kind of excrete this. So we are doing more fluid. It's the same as drinking, except the absorption level is different. It's going into the bloodstream as opposed to going in the stomach. We're bypassing your GI tract. So we're not going anywhere near your stomach, which for you is great because we were...
He just stuck me with a needle.
Yeah, I was trying
Wow,
to...
that was painless.
Yay!
This guy is good. What is your name?
My name's Justin.
You're invited to all my parties, Justin. Jordana,
I'll be waiting
your
for the
microphone's on.
I know, and I was worried about you.
So do people sometimes pass out when you do this?
It's really rare, but there is such a thing called the white coat syndrome. Some people feel nervous around
Needles.
or any medical professionals. They call it
the white coat.
The
Oh,
white
I
coat
get it.
syndrome.
I see.
And so even if you go to the doctor and your blood pressure is always, call it 120/60, it might be elevated because you're just nervous because you're in the doctor.
Well, okay, the needle's in my arm, it's hooked up
Yep.
to the tube. Why is nothing coming out?
Coming out, we actually have...
Oh, it's going in. Sure.
Yep.
I thought I'd see the blood coming out.
No,
It
we
should
actually
be.
have... It's
Jordana,
actually...
don't make that face. What am I, a medical professional? Every time somebody took the needle into my arm, I see the blood come out.
Yeah, so
No blood's coming out.
That's for a blood draw.
Well, that's what I've done
Yep.
before. I've never done this.
Absolutely. This is...
Excuse me for just a second.
You might pass out.
That could be a question. A person could say, no blood's coming out, right?
He must be really sick.
No, it's
He's
fine.
delusional at this point.
We
may speak.
hear significantly weirder stuff.
Thank you for that. So
There's a little bit of blood inside there. If you're
there's a little bit of blood. I can see we did it. So now what's happening to me as we speak now?
So right now, I'm basically pressurizing this. I'm pumping this up a little bit. Like I mentioned before, it's a pediatric size needle.
Right, small needle, pediatric size.
So because of that, if we were just going to do a regular gravity drip, how a drip is usually done in a hospital or whatever, it's just done with gravity. This would take a little bit over an hour actually.
So is it coming into me now?
Yep, this is going into you. Yep.
I don't
So-
feel anything yet.
Yeah, and you can actually, you won't really feel much in the way of.
Although I'm getting
You get a little
or
taste?
I'm getting like a thing in my nose. Wow.
Yeah.
It is. I'm going through a Flintstone vitamin right now. That is so weird.
Yeah. It's...
It
I would
feels like
say
I'm eating a vitamin.
it tastes like
Oh
the
my gosh, that's
smell of inside
Very
of
noticeable.
Yeah.
Huh. So fluid's coming in. Wow, that is amazing.
That's the taste and the smell of success right there.
That is amazing, though, that quickly it can
It's
be-
pretty much instantly. Yep, absolutely.
That is amazing. So I'm instantly sensing it, but I don't know that I'm instantly getting more beautiful or less hungover
I can
or less
see it from
You
here.
look, you look
or
younger
less
already.
jet lagged or whatever it would be. So how long will it take him to put this
So this will be about a 15 to 20 minute
15 to
treatment.
20 minute thing? My show's over in 16 minutes,
Perfect.
but that's okay. I
We should
can
be wrapping
continue.
up about that time, yeah?
And so then you would pull the needle out
Yes.
when we're done, and then what happens? The person just goes about their merry way?
Yeah, they go about their merry way. A lot of people feel the effects of this immediately. A lot of people feel it a few hours later, but almost everybody will say they feel it for sure the next day.
The
So
next day.
I'd love to circle back and see how you
Oh
feel
yeah,
the next day.
well let's talk tomorrow. Tomorrow at this time.
Yeah, or even tomorrow morning, because you were severely dehydrated from being ill.
I have been.
Yeah, I feel like you're gonna sense this sooner.
Wow, I can absolutely tell stuff's going on with me right now. You know,
See, we took care of you, John. You yelled at us for setting this up for you.
because your motive was different than that. Yeah.
I don't know.
But I'm going through the total oral, the nasal, the taste sensation.
Yep.
It feels like everything but I've got a vitamin in my mouth. Now, I'm probably just saying this because I want it to be true, but I actually feel a little better.
Especially someone who, like a hangover patient who has been dehydrated, or a cold and flu patient
Mm-hmm.
who has been dehydrated. Even athletes, they say they can literally feel it immediately.
So what's the lag time between I call and you guys are in my office?
It all depends, but we are kind of an immediate company. So if you call us and it's 10 o'clock in the morning and you said, could you be here at noon, we can probably make it work.
Here in the metro.
Yeah.
Here in the metro, yeah.
How's business?
Phenomenal. So
Really?
good. Yeah, so good.
What's most of it? Is it hangover? Is it athletic performance?
Surprisingly enough, our athletic recovery and our health and beauty bag is they're just at the top.
Health and beauty bag.
People love our health and beauty
Who
bag.
gets a health and beauty bag?
Anyone and everyone. That's who we're going to give to
Women
you.
in their 50s?
Literally everyone. Literally
And
everyone.
do you give that to your wife as a gift?
Yeah.
Hey, honey, I got you a health and beauty bag. That doesn't sound like
That's
a
the
nice
gift
thing.
of wellness right there.
Well, that's a better way to put it. And I suppose after the marathon, that would be good for you the next day, because everybody's just limping the next
Yeah.
day after a marathon.
So the
or
reason
2
our
days.
athletic recovery bag is so huge and the reason the Vikings players love it is because we've got an amino acid blend that helps with the soft tissue recovery. So the muscle cramping and the tightness and the weakness that comes from, these people are doing, severe work. I mean, they're getting in essentially car accidents. Their bodies are going through almost like a car accident
Yeah.
multiple times in a game.
Yeah.
So that's a lot of shock. It's a lot for their bodies to absorb. So that cramping, weakness, fatigue, all that goes on with their muscles is what our IVs help with.
So we took about Jordana, you did this too. We both travel with our listeners. We go overseas, we come back, and then the next 2-3 days, you're just on planet 7.
Yes.
You would do a cocktail of something to benefit me after jet lag.
I would actually suggest, and I tell all of our patients who travel
This is a good idea.
before and after.
Yes.
So if we load
Sure.
you up with fluids before, the most dehydrating place in the world is in the sky. Because your recycled air think about it, it's just kind of gross. You cough, and then that goes to the back of the plane, or it's just gross. So we load you up with vitamin C in our jet lag or in our fatigue bag. Load you up with vitamin C. That can actually trick your body into boosting its own immune system, and now you're like a fighting power when you get on the plane. Then when you get back, we can load you up with that same bag, and then the B vitamins are kind of where your energy is. So we load you up with B vitamins when you get back, and now you've got more energy to tackle and to get yourself back in order.
We're almost out of time. But really, this is about the delivery system as much as it is. I mean, I could take vitamin B and vitamin C, but it's about the immediacy. It's about the delivery of it.
And it's about the absorption level.
Yeah.
So it's 100% absorption. Whereas if you take a multivitamin, if you take a B12 supplement, if you drink this water, you're only getting about 20% of it, at most 50, let's call it.
The company is called Hydrate, Minnesota.
How much does it cost?
Anywhere from $99 to $149. So the cost of our bags kind of range there based on the different amounts.
Do you do a discount if I get 2, like coming and going from the flight? That could be a question.
That's a good question.
Well, we are a medical company, and so everything we do is by the books, and we've got protocols and procedures for everything we do. We don't usually do a lot of discounts on stuff.
What price a hangover though, Jordana? If that could get you back on your feet
Like
again.
$7,000.
You know, if she had said it's $5,900, we'd go, yeah, I'm okay with that. That sounds right. That's where I was. That was my ballpark.
CBS is paying.
It is 6:49. All right, we'll pause one more time here, and then we'll visit for just a few more minutes with our guests. We're live streaming this on Facebook. If you're watching us, there's the needle. It's in my arm. No blood is coming out. You know why? Because fluids are going in, you dummy. You're not supposed to bleed out on this thing. It's 6:49. That's a Wixon Jewelers time check. Wixon Jewelers, extraordinary collection of colored gemstones. They're just off 35W in Bloomington.
What you thinking,
Well,
George?
thank goodness he's
Jerry
surviving.
Peterson.
Thank goodness he's doing okay. Seems to be feeling better now. Getting even sassier during the procedure, so I don't know if they put a little sass in the bag. But it looks cool. I kind of want to do it.
We have 32 viewers right now, thanks to everyone who's watching us live on Facebook.
That was fun,
And Carol has a really good question. If it helps getting over muscle aches after a winter fall, let's go ask Bryn what she says. We have a question from one of our listeners, Carol. If it helps getting over muscle aches after a winter fall, I'm in. How about something like that?
Yeah,
Just
absolutely.
It's a very flexible. Yeah.
Bruising and swelling, all those things, that's fluid buildup.
You know, it's
We can
really
actually just help to get fluid
Within
moving the way it
20
needs. Helps with muscle recovery.
It's like right here.
Vitamin
Go
C actually
holding
helps
back
your
my
body
throat.
to
Yeah,
heal
I wanna
internally.
ask you,
So if you
is
do
there
have
your
bruising or
side?
pain
You
just
said
in general,
the nausea.
and you're healing from
Right.
something, I
We
always
do
tell my
also
patients
have-
load
we
up on
have,
protein and
the
vitamin C.
pharmaceuticals called
Obviously, we can't put protein
It's
in the bags. We
basically
only do
ibuprofen.
water
It's a very
soluble
strong
vitamins
version of
because
ibuprofen.
then
Body
your body can
aches,
excrete it
Oh,
just
yeah.
through your
things
urine.
like that. What I call adult
But
pain,
protein and
Right.
vitamin C
So
loading
I
up
can-
on that
that just goes
huge
right in
will
your
help.
bag.
But
Oh, really?
definitely
You can do that,
IV
too.
will help faster.
Well, I
We actually
have
can also
been. I
administer
mean, like,
IV
you know, right now, do I feel
anti-inflammatory
100%
drugs. So
nausea-wise?
if you
No.
have
I feel a
a big
little-
bruise
As far
or
as
you've got
nausea,
pain
no,
or
but
swelling
it's- but like
or
it's hard-
a
and it's
hangover
like headache and
and
muscle
it's
pain.
now
Oh, I had terrible
you've got the
muscle
spins
aches,
or a
right?
headache,
Like,
we
I'm
can
fine
actually
after
take that
that.
away
You want
pretty
me to
still put a
immediately
little
with
of that
IV
in?
I can
Toradol.
put it in.
We've heard a lot with weight loss when you have
Yeah,
excess
that's what I
skin
definitely
that the
recommend
best
to
way
you.
to
Because
lose
I
that
do take
excess
a lead,
skin
which I've
is to
never
drink
taken.
lots
That's
and
okay.
lots and
Just
lots of
two.
water.
Okay.
Would something like
And
this
the lead
help
is,
with
the
that?
lead is
Tons
not
and
very
tons of
hard
people
on
are
your
actually
digestive tract.
helping,
It's better than,
are
like,
using this to
ibuprofen
help
or
assist and aid them in weight loss.
but it's
Most
also not quite
importantly,
as
what we put in here is a B12 supplement. B12 helps threefold. It helps you regulate your metabolic rate, so your metabolism does this all day. If we can get it to just stay here, then we don't get those peaks and valleys, and we don't hit that crash, and then when we hit that crash, that's when we go, oh, I'm going to eat crap. We don't want to do that. We want to keep your metabolism where it is. You want to be able to go, and then crash at night, and then be done for the day. It also helps with your circadian rhythm, which is awake at day, sleep at night. That's B12, and then also is your body's own precursor to making serotonin, which is your happy drug. So B12 makes people just kind of have this nice euphoric feeling. So it gives you energy, like caffeine without the crash and without the jitters from caffeine. It just gives you sustained energy.
okay?
B12 is
Yeah,
pretty much
57,
amazing.
55.
And
is our
again,
out.
because you're getting
And then I
it
have to
through
break down the
intravenously
right
rather
here.
than taking a
In the bloodstream.
B12
He's gonna put in
supplement
something to
orally,
make my
you're
eyes
getting
see.
more of the vitamin.
People say like, oh, I take a B12
Oh, okay.
pill, and I say, well, is your poop green? Because it literally, it can't be absorbed that way. It
Yeah,
has to be absorbed
that's
into
true.
the soft tissue, which is sublingual, or in the
Check this out,
IV
George.
or muscle or subcutaneous. So you can do it in a
Look.
shot as well.
Awesome.
Yeah, it's really
Awesome.
cool. We got cool stuff.
How you feeling, Mr. Williams?
Pretty good. He's adding some extra stuff in here.
It's Toradol is what I just added to that. It's a pharmaceutical that we carry.
Because I was in like total body pain.
This will help.
This is good for any kind of headache, any kind of joint pain, what I call it adult pain, basically. But we have two pharmaceuticals. We have Toradol and we also have Zofran. Zofran is good for any kind of nausea, and this is good for any kind of headaches, joint pain, any kind of muscle pain like that. So
And
and that's
inflammation,
any kind of inflammation.
So
It's anti-inflammatory.
that would work with the lady who said I fell on the ice, and I have.
and migraines too. Migraines too. Migraine patients love us. Correct. Migraine patients love us.
Yes. Yep. Yeah, because our medical director. Yep. I basically work on the same legal. I'm a paramedic by trade. I work on the same legal principles as a paramedic does on an ambulance, doing remote medicine, like as an extension of it.
Yeah, but isn't that interesting? Because this isn't an emergency. This is optional. But I guess the protocols are the same.
The way the company set up
licensed
protocols
to-
and procedures, we don't make decisions in the field. We have standing orders. They're called standing orders. It's an order that comes from the doctor that says, if this, then give this. So all we have to do is A or B. B, okay, do this. A, do this. So we're not practicing medicine in the field. We're just given an order and told to do it. And if you say you have body aches, that's a way for us to say, okay, we can administer this. And based on your health history form that you did answer, we know your medical background, and we know if this is a safe thing for you, based on everything you told
Well, I
us.
mean, wow, it's amazing the vitamin taste.
Yeah.
It's not unpleasant, it's just
It's just
noticeable.
there. Yep. Hey, do you have B12 in this diet?
There's not, no.
Okay.
Yeah,
Would I notice that too?
You'll love B12.
Why is B12?
B12 is amazing in 3 ways. I was actually just explaining it to her. It helps with your circadian rhythm, which is,
Can I do this?
yeah.
Yeah, that's fine.
Go ahead,
we
you
go.
can finish, Bryn.
All right, thank you, Mike Max. Jordana Green's in the studio. JG, what are the headlines for your show this evening at 9 here on CC?
Man survives needle in arm on live radio.
It's a soft plastic catheter.
He's so smart.
They do the needle, and then he just pointed it out to me. He says, "Are you nervous about there being a needle in your arm?" And I go, "Yeah." And he goes, "It's not a needle. It's a pliable catheter."
I'm
So-
sensing that you're more energetic, John. I think it's working.
I feel it.
No, I'm totally serious.
We're
Dude was
visiting
sick.
with the people from Hydrate MN, and it's called Mobile Concierge Hydration Therapy.
Hydration therapy.
Wow.
Yeah.
What are you doing tonight?
All right, I'm going to talk. I'm on this mission to make everybody either feel better about their job or get a new job in the next year. So I'm
Yeah.
going to talk with my executive recruiter, Miguel McMore, about how to not be crippled by the job search process. You know, you think about, I got to look for a new job. The first is so overwhelming. Either I got to write my resume, or I have to find out what LinkedIn is, or I have to network. Taking that first step is often, you need that push. So she's going to talk how to not be crippled by just making the first minute step toward bettering your career and bettering your, or if you're looking for a new job.
I like that. That sounds like a good idea.
We're going to take baby steps each week. Miguel and I are kind of on a mission to have people feeling good about, going to work and, how they spend 8 hours of their day. So join us tonight, starting
Steve
at 9.
Thompson, after the news, is in for Mike Max on Sports to the Max. Obviously, Tracy Clays, Go for Football, stuff like that, one of the topics there. We are wrapping up this half-hour-long conversation with the folks from I want to say new company. Bryn, how long have you guys been in business?
About a year and a half.
Bryn Ahrens is here. She's the CEO of Hydrate MN. And as we said a moment ago, it's a sort of concierge hydration therapy service where you can get an IV for whatever ails you, including sports performance, but also hangovers, jet lag. I was terribly ill 36 hours ago. I had some violent 24-hour bug. I'm able to come to work today, but when I told them, I said, I don't think I can do this because I've been pretty sick lately. They went, oh no, that'll be good.
Yeah.
Because,
We were more excited than you were.
right, oh, well, I guess you would be, but I
Now,
mean,
tomorrow you'll talk about how great you feel.
I'm a better candidate for this service. Would somebody do that though if they just, had real bad GI distress for a day?
Absolutely. Actually, people call us in the midst of real bad GI distress.
Really?
Yes, because we can actually take that away. If someone's feeling super nauseous, like Justin was saying, we've got an anti-nausea medication that, it's immediate. If you're feeling nauseous, that medication goes in and you immediately stop feeling nauseous. It's immediate.
We're out of time. Bryn, it's nice to meet you. The
Nice to
gentleman
meet you.
who's been literally doing this, you do it, but you said I'll talk and he'll do it. What
Yep.
is your name again?
Justin, my name is Justin.
Justin, and you're Bryn, and you guys are in the Twin Cities, right?
Yes.
Yeah.
Yep.
Okay. Nice to meet you. Thanks for doing this. Jordana, it wasn't
a lot.
as scary as I thought it was going to be.
Well, I'm glad, John. I'm glad you're feeling better.
I'm such a big boy, aren't I? All right, then.
You want a sticker?
Pediatric needle.
And patient. The news is next.